Hi, everybody. Welcome back to Just Around the Corner. I'm Sarah Daniels, and today I have with me Jessica Cash with Salt Health. She is the Chief Experience Officer, and I'm just really excited to have you on today, Jessica. Thank you so much for joining and being willing to share with all of us what Salt Health does, who you are, and so yeah, I'm excited to explore that more today with you.
Thank you for having me, Sarah.
Yeah. Well, just right off the bat, would love for you to tell us about, who is Salt Health and how did you guys kind of come to be?
So, Salt Health really has a goal to simplify the confusing healthcare system and do root cause medicine, really try to dive deep with people to get to the source rather than cover up. And so, we are a medical clinic and a wellness facility. We have a team and we partner with our patients to really live life healthy. That's kind of our tagline, is to live life healthy. And it seems a little cliche, but it's true. That's our goal.
I love that.
We,
Yeah.
we have, so as you know, chronic illness is on the rise in America. It is a epidemic at this point. And so we are all about the team approach of trying to get down to what is causing this and how can we get better and how can we prevent it for future generations. And so at Salt Health we have a medical clinic, a spa, a fitness center, and our patients, we call them members, they have access to all of it. They have access to our full team. We have, my physician partner is Dr. Anna Herbst. She is a family practice medicine provider, and we have a who is trained in functional medicine, and then we have a nurse practitioner who's also trained in functional medicine, and then we have registered dietitians, health coaches, phlebotomists, nurses, massage therapists, physical trainers, a whole team of people working with you to live out a healthy life.
Yeah, that's amazing. I love that there is such a broad network of services that you're able to provide and really sounds like a collaborative team effort of wanting to provide members this experience of getting to really address whatever issues that they're facing in a very holistic and collaborative way of getting to that root and providing a lot of different angles in which to really address those needs.
When we started, so I was a patient of Dr. Herbst, and my husband worked in healthcare administration, and there was frustration just being a patient of how do I get answers? Why don't I get time with my physician? The average family practice doctor only gets about 7 minutes with their patient. Um, and that's purely driven because there's not enough time. And there's a lot of caring individuals, providers out there, but they don't have their time or the resources to be able to really dig in with their patients. And so when my husband and I were talking about, how does this different? How can we do something different? We came up with the Salt Health plan, the idea, and I reached out to Dr. Herbst. She had been in Oklahoma providing care, and she had gotten recruited to the Cleveland Clinic to start the Center for Functional Medicine at the Cleveland Clinic, and which is a new and revolutionary idea. And people fly in from all over the world to the Cleveland Clinic to receive care there. And my husband, being the sweet spouse he is, said, Dr. Herbst is not going to leave the Cleveland Clinic to come to rural Arkansas to start a medical clinic with us. And I said, okay, we'll pray about that. We'll wait on that. But when I called her, she also had already had a vision and a passion for doing primary care, because a lot of functional medicine is that deep dive root cause medicine, which is amazing, but the walking it out day to day is a hard part. And a lot of times people have a hard time finding medical providers that they can partner with on that long-term basis to walk out that healthy life, that getting strep throat 3 times a year every year is not healthy and it's not normal. And we should be doing things to not only get well but also prevent that in the future and not mask it. And so that was kind of how Salt Health started and our vision. We wanted to come to Arkansas because it's an amazing place and has amazing people, and there's a lot of focus on health and wellness and um, you know focus on the next generation. And so we wanted to come here.
That's amazing. And really does feel special that you guys are in Arkansas, of all places, and really amazing that Dr. Herbst left the Cleveland Clinic to come and be a part of Salt Health, and really this mission towards getting to the root cause and not only helping those who are experiencing symptoms reach wellness, but prevent future symptoms or future like illnesses that are not being addressed simply through because we're really just addressing symptom care. And so I think that is a really revolutionary way of practicing and is so needed. And I'm curious, the term functional medicine, I think people are getting more familiar with, but for those who don't really understand what that means, could you kind of give like just a brief description of what you mean by functional medicine?
So the functional medicine approach is really that systems based, um, diagnostic, scientific, evidence based um, medicine. And so it is like we use the term diving deep. We do tests that go much deeper than the surface level. We do our blood test panel has hundreds of indicators and gives results, and we look at that as a picture of a whole as a whole. When a patient comes in for their first visit, they go back to birth. The team goes back to birth with that patient because the environment you were born into, the water you drank as you were a child, the things you were exposed to as you were, going throughout life, all of those play into who you are and how your body is functioning now. And so that functional medicine approach is really that blending of, okay, let's dive deep with the patient. Let's get to that root cause and not just the pill for the ill, which is a lot of times, unfortunately, what we resort to when there's not enough time, when you can't dig in, and when there's not a straightforward answer. It's not an easy way to practice medicine for sure, but you get much better results. And the results are more long term and sustainable because if I know that I have these issues or I'm predisposed to these things, then I can, take steps to mitigate that or prevent it in my life. And, hopefully be healthier, be happier, be more productive, be a better mom, be a better coworker. I can do all of those things.
Yeah, I think that's a really beautiful description of functional medicine. And really, the key themes that I heard in that is what's different is that in a lot of ways, the traditional medical system is pretty fragmented. Of you might go see one doctor who is then going to give you a recommendation for you to see a different specialist, and there's a whole different process for that and waiting list for that. And there's just a lot of red tape, and it can be really hard for to get a kind of whole picture of what's going on, which can make it a lot more challenging and take a lot more time for individuals to really get an understanding of what's going on. Um, and what's unique about Salt Health is that there is a team of professionals in all different spheres who are working and talking together to say, okay, let's go all the way back to birth. And we're going to look at this issue from every angle to really get a better understanding of what's going on. So we're not just addressing one piece, we're really looking at this person in the whole. And I think it really, another part is viewing health as an interconnected system of we're not just looking at one body part as a separate entity that isn't impacted or going to be impacted by other parts, which I think is so important and essential in true wellness. And I think it's even just, yeah, go ahead.
No, I was just going to say something that we do differently at Salt Health and that we really feel like we're pioneering is we call it functional primary care. It's that partnership with your provider for that ongoing care and looking at your body as a whole all the time. And specialists are amazing. Oh my gosh, if you need a specialist, it is amazing to find these very knowledgeable people about very specific systems. You can't be an expert in everything. But to your point, if you can do the foundation work, the primary care work, then hopefully you don't need the specialist as often, or that that for instance, we do genomics work. And Dr. Herbst, there is a line on our genomics report about anesthesia, and some people do not metabolize anesthesia properly, and it will throw them into some mental psychosis. It can hurt you, physically. I'm sorry, I'm not the doctor. I'm not going to be able to explain what it is, but I do know that you can have these adverse reactions to anesthesia. But you don't know that until A, you either have that adverse reaction, or B, you do the genomics test with the Salt Health team, and then you know that, so that if you do need to go in for a surgery or if you have some kind of procedure, you know ahead of time, hey, I can't take that particular anesthesia. I need to talk to the anesthesiologist, the specialist, about what are some of my other options. And it's amazing because it's just more knowledge about your body and knowing how you operate, and personalizing. It's that personalizing your medicine. And in your world, that's really common, of personalizing medicine. Unfortunately, in the primary care world, it's not. We tend to fit in boxes, and if you check off these boxes, then this is the treatment. Not always, but unfortunately, the system is built to be very generic and not personalized.
Yeah, I love that really personalized care and really helping to kind of get a better understanding, laying a foundation so that when you do go and see a specialist, that there's really a basic knowledge of what is needed. And you're not really going in blind, so to speak. And I think that's really valuable. And I'm curious, as you're sharing, I'm thinking about listeners who are saying, okay, I'm interested. I have either some health issues that I already am facing that I want to gain a better understanding of, or they're just curious and they're saying, okay, at some point, it might be beneficial for me to tap into these resources. Can you tell us a little bit more about who is your target population? Like, who would be a good fit for Salt Health, and how would they gain access to the services that you all provide?
So our functional primary care services is membership based, and we do that because it is an ongoing relationship. And so that's an annual subscription. And our members are members, and until they decide to leave or decide to move. It's a very transient community. And so that's kind of our functional primary care. We have recently added functional medicine testing. So a lot of people don't necessarily need a family practice physician, a family practice team to help walk out their day-to-day lives, but they do want those deep dive insights, and they want a functional medicine team interpretation. Dr. Herbst has uh, almost 20 years in this space. She was a naturopath, a doctorate of naturopathy. She went on to med school because she wanted to know both sides of the spectrum. And so she went on to med school, and then did, like I said, did primary care in rural America, went on to the Center for Functional Medicine, worked there for several years, and now is here at Salt Health. And so she has really curated this team, and their wealth of knowledge. Oh my gosh, I learn from them. I have a podcast also where I am constantly interviewing them, and it's so much fun because I'm learning new things. My listeners probably think I'm crazy. They probably think I should know some of these things, but they're just such a wealth of knowledge. You can't glean it all in just day-to-day conversations. And so we also serve anyone, any individual who is wanting to do some deep dive testing. We have those available. We do gut testing. So what I've learned from the team is that so much starts in our gut. You know, our if we are not able to absorb and metabolize the nutrients that we are consuming, the energy we are consuming, our hormones will be messed up. Our obviously our blood work will be messed up. I mean, everything really starts at that foundational gut level, and so we have done a gut test. So it's called a digestive health test. It's a GI map. It's a gut health test, and it gives a wealth of knowledge, probably more than most people wanted to know. But it is amazing because it is a really great way to say, hey, you know, well, for instance, my daughter was having issues when she was little, and so we did this test, and we found out her body was being inflamed by something she was eating, and I didn't even know it. And it was really causing problems. And she was that typical colicky. I'd gone into her pediatrician, and they just said, she'd grow out of it. It was colicky. But it wasn't. It was more than that. And it wasn't until we did that gut test and did that deep dive with her, and that we were able to get those results. And I was able to make, no dietary change is easy. I don't want to blow that off, but it was a simple change. It wasn't like a medication. It wasn't, huge life altering, but it was it was life altering for her and for our family. I got to start sleeping at night. And so we do that from, babies to, adults. We also do blood test. We have a heart health test, hey, do you have heart issues in your family? Are there things that you would like to look into? Because a lot of people have concerns. And so it's like, well, don't just wait to see if something is wrong. Let's do one of these deep dives. We do a CIMT, we do blood work. We do all of these tests on your heart to give you the peace of mind of, hey, my heart is healthy and I feel good about this. And it's also great information that you can then take to your primary care or, your cardiologist. And you can even do it if you're doing it on a regular basis. You can have points in time of so that you can follow your health and make sure that you are, staying on top of that. We also do, like I said, we do genetic testing, genomics. That is an incredible deep dive that Dr. Herbst and the team does for individuals who are interested in that. And then she also does we call it our comprehensive functional medicine package. And a lot of people come in to SALT and they've been bounced around the specialties and don't feel like maybe they've gotten answers, that it's kind of been an enigma or a mystery, and they haven't gotten to do that to really get solid answers, or they've been diagnosed with some kind of autoimmune issue. And if I've learned anything, is that autoimmune issues tend to be kind of just lumped together, that they're not really well understood, and how to treat them is not really well understood. And a lot of times everybody is different. Obviously our bodies are different and how we respond is different. Alpha gal seems to be on the rise. I mean, there's all these terms that weren't hearing even 10 years ago. And so it's like people are sick. It's their bodies are physically ill, but they haven't been able to get answers. And so we do a comprehensive functional medicine package, and it is a all-in deep dive. It's actually very similar to how Dr. Herbst did it at the Cleveland Clinic, except that you have multiple appointments there. You might only have one appointment along with your test testing. With us, you have multiple appointments. You meet with the registered dietitian, you meet with the health coach. We really want to make it something where people can get answers and then they leave with a plan of action of this is the way forward and I feel good about this. And so we have some of those options also.
That's amazing. Yeah, there's so many different options for people to access. And I think something that really stands out is kind of what you mentioned earlier of that doctors typically spend like 7 minutes with each patient. And I think what's really unique is that this is a relationship. It's a partnership of we're walking alongside you. We're going to continue to check in and really build a really comprehensive scope of what's going on. And it isn't just necessarily, let's take a quick look. I think something that you mentioned that I'm curious about is with all of these amazing resources that you have, there's the membership. How do people become a member?
Well, right now our membership is closed because we want to make sure that we have enough time with each of our members and we're delivering what we promised. We don't want to get back to the 7 minute model. It's just not feasible. And obviously people aren't getting well. And so we closed membership. We have a new physician coming on. And so that will open up new membership. We're excited about that. And, we're excited about expanding other services and offerings like our functional medicine packages. We're calling them precision health packages because it's very precise and it's very personalized medicine. And so we have those options also. But
Amazing.
our membership has a wait list and we try to get people off the wait list. We just, don't have any time frame to be able to promise people when we're going to be able to open that up. And so with recruiting a new physician, that will help amazing. But we've been very intentional about that process, it's been a slow but steady process because finding the right person who wants to do the functional medicine aspect with the primary care knowledge and obviously fitting our culture and our practice of medicine is always important. And so we've just taken our time and interviewed lots of people, and so we're looking forward to bringing on that next person.
That's great. Yeah, and I love that, even though membership is closed at this point, that you do have wait lists and that you really are, it's not about how many people can we take on, it's how can we really build a quality relationship with those that we are serving. And before we try to take on more, that we really feel like we have capacity to give those who are in our care the best care possible in a very personalized treatment plan, which is really, really valuable. And it even just makes me think of back when you were talking about your daughter. There really is this sense of in Salt Health of you don't have to be in crisis to reach out. It's okay to say, I don't really know if there's anything wrong, but I want to have a better understanding of what my body is doing, what's going on, maybe what I might have propensities towards that I might not have even been aware of, which I think is so valuable. And even just as a therapist, I encourage that for my clients all the time, whether it's physically, mentally, whatever sphere they're in, of we don't have to wait until you're in an ER situation to get help. Like you're allowed to seek help before we get to that place where the worst thing has happened and we don't know what to do next. In fact, it's
Thank,
encouraged.
thank you for being an advocate for that because I grew up in a family, God bless them, where we did not go to the doctor unless we were bleeding or dying or had a broken bone. It was truly we used it as emergent urgent care, that it was not an ongoing relationship. And it wasn't because we didn't believe in, or trust our physician. It's just more that we didn't understand that, the preventative side. That was not a focus. Definitely not in the area I grew up in. And so changing this American mindset of let's start when our kids are babies. And but even now, let's be preventative, and let's if you when you at the first sign, that's the great part about membership, about our primary care membership, is at the first sign of not feeling well, people are coming in, they're getting IVs, they're seeing one of our providers, they're doing preventative things so that it doesn't turn into a full-blown crisis, that we are trying to head off some of those you know more vicious attacks on our body. And so what are those things that we can be doing constantly, just at home during our lifestyle? And part of that's with our health coach is she teaches us, okay, these are the supplements that are personalized for you. We don't just, go take a bunch of nutraceuticals just for the fun of it. We really try to personalize our medicine based on, all of your testing. And okay, so these supplements help your body stay well. But you also know that sleep helps your body stay well. What are some sleep habits that we can start integrating into your life that are going to help you be healthy in the long run? What are eating habits? Working with a registered dietitian, when we're fueling our body, calories are not the same across the board. They're, and thinking about that and teaching our kids and future generations to think about that. I love apple seeds in Fayetteville, because they have this mission of teaching kids to think about the fuel they're putting in their body, and it does have an effect down the road, whether it's not feeling good later that night, not being able to sleep, not being able to focus on schoolwork. All of those, we have there's a direct correlation in how we live life and how we feel. And partnering with experts and people who care about you and who want to get you well and who know your history can be life changing. And it is life changing. I don't get to be at the front desk very much because our care coordinators work there, and they only call me when they are really desperate, which is probably smart. And so, but I love working at the front desk because I actually get to talk to our patients and our members and hear experiences. And I can't tell you how many times I end up crying with people because they felt relief or they felt heard. Just feeling heard sometimes in the medical community. I know that's where your specialty brings in so much value. And because being heard is so much of the healing process, because we need to know where we are to know how to tackle the problem. And so it has been so fulfilling to be part of this team and to be part of this founding this organization. I really feel like it is just when we had this concept of this idea, it was such a seed, and it has just bloomed and grown so much more than I could ever ask and imagine. And I'm just honored to get to work with other amazing people and connect with other amazing people. It's exciting.
Yeah, I love that. And it's truly so magical getting to connect with other people who are working towards this goal of how do we truly listen and understand what people are experiencing, and not only help to reduce and resolve the problematic symptoms that we're seeing, but also provide a way for people to practically nourish themselves and really take care of their bodies in a very just empowering and compassionate way. And I think that that just really encourages me and excites me, knowing that Salt Health is doing what you all are doing, and that um, you are really trying to listen, understand, and come alongside people in a way that is really, really needed. And so I think that, yeah, just feels really good as somebody who's also wanting to do that, knowing that we're collaborating in that effort together. And so, um, for people who want to get connected, what are the best ways for them to reach out?
If they're interested in reaching out to Salt Health, you can get on our website. It's salt-health.com. We have lots of great resources there, and we're adding daily. You're also welcome to call our front office. And a care coordinator would be happy to talk to you. We've got those resources. People can come in for a tour. We have our medical membership, and we have our precision health packages where you don't have to be a member. But we also have a spa and fitness center. Our spa has an infrared sauna, a steam sauna. We have a eucalyptus inhalation lounge. We have group fitness classes. We have all kinds of things for our spa and fitness. And there are people who are just spa and fitness members because we're a boutique small fitness center. We have some classes and some experts in training that aren't necessarily everywhere, and so they have access to those things, and so we also have that available.
Yeah, I love that there's a lot of variety in what you're offering people and how they can tap into that. And so it's great to know that they can access the website, that they can also call. You mentioned too that you are also part of a podcast where you're talking more with the practitioners in SALT. Can you tell us a little bit more about that?
Salt Health has a YouTube channel, and we have been growing that and cultivating that over the last year. And so if anybody wants to get on and hear all the different providers, it has not been something I have loved, but I love getting to talk with people. So I don't think any of us enjoy listening to ourselves.
Yeah.
And
Yes.
so I'm a little hesitant to tell people to actively go, but there is such great information on there. The Salt Health YouTube channel is a really great resource for anyone who wants more information and direct from the provider's mouths.
Yeah, I think that's a really, really great resource. And um, I can just identify in that I don't think I've really ever enjoyed or wanted to listen to any of my episodes. To hear myself talk, it's a weird, it's a strange feeling. Um, but yeah, I would highly recommend that, especially for listeners, if you're listening to this episode and you're saying, okay, I really want to know more about specific areas of Salt Health, it sounds like this is a really great opportunity to kind of hear from each practitioner that you're speaking with, kind of more in depth of the services they're providing, the skills and the background that they are coming with. And so that's really valuable.
And
Oh,
also just great tips and tricks. We're not the goal was not to be salesy in any way. The goal was to really provide good content. And I did a mom's podcast, because a lot of times keeping the mom healthy of the family, from personal experience, is very difficult because you're focused on everyone else and you're stretched 1,000 different ways. And so we talked to Dr. Herbst, and we talked to other providers of, okay, what are areas that you can do to support yourself that you can do at home, or that look into for personalizing your medicine and your care. So that's been fun, is digging in deep and getting some of those great insights.
yes. Yeah, it's so valuable to have just really practical steps that we can just take in our personal lives, of how can we work towards wellness. And I love that you're addressing moms of, I feel like moms are in a lot of ways the heart of the home. And if they're healthy, everybody else is going to be healthy because they're doing so much. And so I love that. And it just, I feel like a big thing that I'm taking away is there's so much richness to tap into in Salt Health and what you all are providing, and that you really want people to be healthy and to get access to a new version of themselves that maybe they didn't know was possible. And so if you're listening and you're interested, I'll be providing links in this post for you to access the website, for you to access the podcast, and to just continue to get connected and learn more. Um, Jessica, is there anything else that you really feel like listeners should know about Salt Health and what you all are doing?
Maybe not so much with Salt Health, but I would like to leave just with listen to your body and don't ignore. Um, we only get one, and it's such a precious one body. And I think that's been a mental and spiritual shift for me of taking care of myself and really investing the time and the energy and effort, because it is an investment. It's not easy, but you're worth it. And I love that you're promoting, taking care of the body, Sarah. Thank you very much for doing that.
Yes, yes, I second that message of listening and caring for your bodies. The one thing I'll just add to that is I think that's such a beautiful message, and a lot of times in my work with my clients, the basic thing of just being able to say, how do you know when you're hungry? How do you know when you need to go to the restroom or when you're tired? And when those needs and sensations come up, what sort of thoughts and feelings are associated with that? And that's going to tell us so much about how we view our bodies and how we can continue to repair and rebuild a relationship that promotes just care and connectedness. And when we can get connected to our bodies, which is all we have, all we've been given, and you're so right, we only have one, there's so much beauty to be accessed there, and it really just opens a lot of doors. And so yeah, I really love that you shared that, and I just second that. And so thank you so much, Jessica, for being on here today. And I just feel really uh again just encouraged by what you all are doing, and the resources you're providing, as well as just the heart. I think we need more of this in Arkansas and in just the world. And so, again, thank you for sharing and just being an advocate.
Thank you for having me today.